Hello everyone, so in this video we're going to talk about how to insert a nasogastric tube. So this is a tube that we're going to insert through the nose, down the esophagus into the stomach. You might insert this tube for a variety of reasons. It could be to give the patient nutrition, so they might have lost the ability to swallow, they might have a narrowing, they might need some nutritional topping up. Or you might insert it sort of a wider tube in order to be able to drain the stomachs if they're building up too much stuff because their bowel isn't working or post-op. The two different tubes we have in this trust, this is our feeding tube. It's a thin tube that's got a wire inside it to give it stability as you're inserting it. It's also got a couple of connectors there, so it's got two different connectors, and it also has lubricant embedded in the sides of it, so you don't need to add lubricant to insert the tube, you can just dip this in water. This tube is a slightly fatter tube. This is our drainage tube. As you can see, it's got multiple holes at the tip there to be able to allow fluid to enter it, and it's very wide. It doesn't need a wire inside to insert it because of the width of the tube. It's actually quite rigid as it goes in. If we're going to insert a feeding tube into the patient, we also need to collect this feeding tube as well, and then to confirm the position of the feeding tube, I'm going to need to aspirate some stomach content out to the patient. In order to do that, we're going to need a syringe. This is a special syringe that's got a particular connector on the end, which will allow me to connect onto the NG tube itself. This is a safety, a national safety thing, so that you can't connect a syringe that's meant for oral supplements to an IV line. So you don't give an oral substance to something that's IV and will retroactive. We'll also, once we've got the aspirate, we need to check the pH of it to make sure that it's below 5, so we know that we're in the stomach. So we need some special paper that will tell us what pH the substance is. We'll also need a device to stick the tube down once we've actually got it into the stomach, so this is NasoFix. Other equipment that we might need is we might need a absorbent pad. There is a risk that the patient might cough, splutter, or maybe they might even vomit, so we need something to be able to catch any of that. We need to have if the patient can swallow, a cup of water, so as we insert the tube, they can begin to drink some water, and that will help the tube go down into the stomach. We might have a vomit bowl just in case. It's not an excuse to use it, but it's just there. And because of the nature of poking something into someone's nose, the patient might inadvertently keep moving their head away, and we don't want to have this weird situation where we're chasing them across the bed. So it might be a good idea to have a couple of pillows which we can put behind the patient so that we can support them, and then they won't keep moving their head around. And because they won't be able to help them moving their head back, they might be able to just support them so they can move into the pillows to make them a bit more comfortable. Okay, so before we obviously perform this skill, we need to do all the things that we normally do. So introduce ourselves, say our role, say why we're there. And for this experience, we need to give some very clear explanation of what we're actually going to be doing and why we're doing it. And then we need to get consent from the patient. It's advisable to get someone here just to help you, or it is something that you can actually do by yourself. Get the patient in a good comfortable position. Sitting up is absolutely ideal for this. Make sure that you put that pad so it's not... so it's covering any areas that you want to keep clean, and then we can prepare our equipment. So this equipment needs to remain as clean as possible, so when we're opening it, we don't want to be wiping it on anywhere or wiping it all over the patient. There's a few things that we need to do just to check to make sure it is safe. So as we open this equipment, and these packets that you'll find, these are really well sealed, so it will take a little bit of effort just to open it. We want to carefully open the packet and take out our tube, and we will then notice that actually the wire is sticking out of the tube a little bit. It's not actually connected. So what we want to do is screw the wire in so it doesn't actually come out by accident, and then we want to measure the distance with which we're going to put it into the patient. So we want to perform what we call the NEX measurement, where we measure from the nose to the back of the ear, and then down all the way to the zippy sternum. So on most patients that would be around the 60 mark, most adult patients around the 60 mark, but our mannequins about 50-55. So we know how far we're going to be putting into the patient. With this particular tube, what we would do now is dunk it in some water so we can lubricate it, so it's ready to be used. And then we need to start to insert the tube into the patient's nose. It's advisable to be as supportive as you can to the patient, because this isn't a pleasant experience, and some people find it really uncomfortable. And the gentler and the more reassuring you are, the better the experience is for the patient. We want to make sure that we don't aim in an upward direction, because that's the brain up there. We want to be aiming in a straight back direction. And we might want to just gently support the patient just as we insert the tube in, and be very gentle, and forwards it goes. And at some point we might encounter the fact the patient might cough or retch. It's James doing some good sound effects about it. If that's the case, you probably just hit the back of the throat, and that's the point where we just need to pause. Now at this point we need to ask the patient to take a glass of water, and we're going to ask them to take the water into their mouth, and then when we say, we want them to swallow. And as they swallow, we're going to insert the tube and allow the tube to move down the esophagus into the stomach with each swallow. So we say, take the water into the mouth and swallow, and then we move the tube forwards. And then with each time, say, take some water out and swallow, and keep moving forwards until we get to the point with which we have reached our measurement. And we can see on the side of the tube all these measurements, and so we're there, we've reached our measurement that we want, and now we're hopefully in the right place. Now we want to then pause here and then ask the patient, they can sort of hold the tube themselves so it doesn't keep wiggling around, or maybe our assistant could do that, and then we're going to take our syringe and we're going to try and aspirate some stomach contents out of the tube. So screw the syringe on and then pull back on the syringe. Oh, lo and behold, I've managed to get some stomach content out of this patient, or some kind of liquid out of the patient. I can then put the cap on so it doesn't, and get the patient to hold that just so the tube doesn't fall out. And then I want to take one of these sticks and I want to run some of that stomach content over the stick so I can make sure and see if there's a colour change and see if it is actually acidic. So if I compare these colours, this pH is between 2.5 and 3, and needs to be below 5, and so I'm really happy. So what I want to do now is I want to secure this so I know that it stays in the right place. So I'm going to, first of all, remove my guide wire from the NG tube so it feels really comfortable for the patient. And then I'm going to screw that cap on. And once the guide wire is removed, I can then tape the tube into place. So for this NasoFix, which is just one brand of adhesive, I can then stick that to the patient's nose, and then I can take that part off, and then stick that to the tube. And you'll find that this is just as fun as trying to put cannula dressings on, especially with gloves. And then wrap that part around the NG tube. And that is now in place in the patient. Now, getting an acidic sample is the gold standard test, so you know that the tube is in place. If you can't get any stomach aspirate, you might need to move the patient onto their left-hand side, onto their right-hand side. You might also then, if you can't get any aspirate out of there, you then might need to actually send the patient for a chest x-ray. Until they get that chest x-ray to confirm that the tube's in the right place, you must be very clear with the nurse staff that you mustn't use the tube. Once the chest x-ray is done and the tube's been confirmed in the right place, you can then take the guide wire out and so it will be then stuck in the right place. Okay, thank you very much, and hopefully you will look forward to practicing this in the lab. Thank you.